I call to order the July 13th Henderson County Board of Public Education meeting. Would you please rise for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All right, next, we are going to observe a moment of silence for the passing of County Commissioner Mr. Charlie Messer. So would you take a moment with me, please? Thank you. He was a champion of our schools, and he'll be surely missed, and so sorry to hear that he left us so soon. Next on our agenda today is the agenda approval. I will accept a motion when someone's ready.
I move that we approve today's agenda as presented.
Do I have a second? Second. Oh, second was Ms. Case. I guess are we still doing hand votes here or voice votes?
Yeah, probably.
Was this noticed as an electronic meeting or an in-person meeting?
Listed as the others were, where it stated it was not an electronic.
Gotcha.
Nobody was in the room.
Gotcha. So no, you can just reflect for the record who's in the room. You do not need to do a roll call vote if
Right.
it's not an officially electronic meeting.
Thanks, sir. All those in favor say aye.
Aye.
Any opposed? Agenda is approved. Board chair observations. I don't have any specific observations today. I think we're going to have a lot of observations coming forward. I guess the only thing I can say is be patient with us. We're kind of waiting on the governor's orders. We're trying to get everybody's kids back to school safely as soon as possible. It's going to be a challenge, as everybody knows. We're not going to make everybody happy. But we are going to try our hardest. I promise you that. Next will be board member observations, if anyone has any.
I do have one. I echo the Charlie Messer. That's a sad loss. I also like to point out we also lost another champion of education, Frank Bird. Was a very good person to the community and to the school system, and always did help out anytime he was asked to. I think to honor his family, it was nice just for us to honor him as well. I also like to give shout out to kudos to Jane King and her staff with the surveys. A lot of positive feedback from the parents, and even the staff was appreciative that those surveys went out. So just kudos to all of y'all for doing that. Very good positive feedback for a lot of that. So
We try to wait on those surveys to come back by the governor's was supposed to make his decision, but we know where that's at. Anybody else have any observations, Mrs. Case?
I think we should recognize Wendy Fry.
Yeah.
Her big award as the CTE for the region. And that report she put together for us must have taken her days and days. And then to Jan King for the report we just got that she put out. Took a long time too, but thanks to all the staff for all they're doing.
Thank you, Ms. Case. Anyone else?
Yeah, I want to agree with Michael talking about Mr. Frank Bird. He was involved in so many nonprofits and organizations. I had the honor of serving with him in Kiwanis, and he was great public servant. And of course, Charlie Messer. I mean, my goodness, what has he done over the years for our county, our school system? He had a strong hand in new schools at Hillendale, at Mills River, Edneyville. He was on the recreation board in our county for probably the whole 20 years he served as county commissioner, and really worked hard for our park system. He helped us get the much needed indoor recreation facility that we have now. A personal story, if any of you saw something I posted about when we were celebrating the grand opening of Edneyville Elementary. I migrated to the gymnasium, of course, and here comes County Manager Steve White, and he goes into the PE storeroom and brings out a basketball. And here, Charlie Messer and Steve White and I, we had shot some hoops there that day. And Charlie was talking about his grandsons. He had two that were starting to play basketball, and he was so proud of them. He said, "Why don't you go with me sometime and watch them play?" I said, so I called him up, and we went over to Asheville and watched him play. And but he was so proud, and we enjoyed catching up on the trip over and back. And I learned early on, if you want to know more about Henderson County and the politics and everything else, that you need to go over to his store and you pull up a chair and you sit there and you talk to Charlie. And he had his finger on the pulse of Henderson County. He was a common man with a common man's touch, but he was really outstanding. And he's really going to be missed. And I think the good relationship that our school board has with the county commissioners recently, especially, has been attributed to people like Charlie Messer, who really sees the need for education and works with us and tries to help make it possible. So you'll be missed, Charlie Messer.
Thank you. Ms. Holt?
So I just wanted to talk a little bit about the reopening of schools. As a citizen of this state and this county, I believe that it should be the parents' decision on whether they're sending their children to school or not this fall. I feel like if you have a high-risk child and you want to keep them at home, our county has made provisions so that you can do online school, and we will provide that. And if you feel like your child needs to go to school, then you'll send them to school. I'm trying not to cry. With that said, I feel such a weight of allowing schools to open. As a mom, I feel like my daughter needs to be there more than she needs to be at home. But I'm afraid for my friend that's a high risk teacher. Her son has ALS, and her husband is staying at home to take care of him, and she's the breadwinner. And so she has to be at work. And I'm afraid to make that decision and cause something to happen to her son. I mean, I know ultimately it's the governor's decision. We can choose, to do stricter guidelines or not. I'm afraid to make the wrong decision and have a kid in our schools die. I'm afraid to make the wrong decision and have a whole generation of kids that missed out on another 6 months of school and are suffering. I'm afraid to make the wrong decision and have parents that can't pay their bills because their kids aren't watched. This has been so stressful as a parent and as a board member, for me trying to figure out what's right. And, on one hand, I really believe our children need to be in school. But on the other hand, I'm just like, what could happen if we make the wrong decision? If, the governor says, we'll go with plan A and everybody can go to school, and we decide not to do distance learning for the, first few months, and we just have tragedy after tragedy of teachers that shouldn't have been there, or students that their parents didn't know they had an underlying condition. And I mean, it's a hard decision. I have people, calling me and texting me every day. Have you decided what you guys are going to do? Have you guys, well, first of all, we're not making that decision. That's been taken out of our hands. And one part of me is glad that that's taken out of our hands, but I don't know. We've just never been through anything like this. We've always pretty much been able to control, and the decisions we made were to kind of enhance our school system. And, we wanted to go with more innovative things, and we've never had something where literally people's lives were on the line. And I don't know, it stinks to be who we are right now, I mean, I know this is what we were elected for, but it's just not it's not an easy decision.
You're
It's
right.
just not.
Thank you so much. Appreciate it. All right, next on our list, it's going to be public comments. I'm going to start. We have 3 public comments that came in today. I believe Coach Wood, yours is first on the list.
Okay. Well, I'll take this off so I can read a little bit better. And I've just seen this, so bear with me. Mention who sent
Yeah,
it
who sent
in,
it,
public
please, yeah.
comment, Tammy Thielman, I guess it is. This is a time for new systems across the board. We do not need to scramble for a temporary system. This is an opportunity for a new system that can be flexible to whatever the future holds for each individual person in the school system, for every student, teacher, and faculty member. Every person involved needs to be heard. Students, parents, teachers, and faculty need to be heard and feel safe. The new system should involve free choice for all those mentioned. All students and parents should have the choice of in-person education or distance learning for any class, club, or school activity. Whether it is one class or all classes in person, or no classes in person and one socially distanced club in person. Whatever the mix match that each family is okay with and feels safe and responsible. All classes can live and recorded. All materials can be online or in packets made available for pickup. They can sign up at the beginning of each year or semester if they want to be in person or distance learner and can change it if their situation changes. If they choose in person, they will automatically be signed up for a physical space in all of their in-person classes. All students can choose day to day if they can come to class in person or online. If classes have to have a number limit, they can sign up for a space through the class portal. In-class learning students have first priority for in-person classes. If a distance learner student wants to attend as in-person class and there is a spot open, they can go. If a class fills up, then either they are online or another class will need to be formed. There will need to be a system to know when another class is needed. Teachers and faculty should have the choice as well, whether in-person teaching or online. They need to feel valued, respected, and safe. Listen to them, ask them, send them a survey. They have ideas, concerns, and passions. Students can access the student class online at home, in person, or online at school. There can be a teacher assistant or a substitute teacher that is okay with being in person in the room for maintaining order, materials, and for questions. The main teacher will be available just as they would be available in the class with a TV, projection, iPads for class instruction, and then private video calls for one-on-one or small group questions. Or you could hire a second teacher for in-person, and student parents can choose which teacher they would rather. Also, watch the weather. And when weather is permissible, have instruction outside, and then there is no limit to class size. Those days are a great opportunity to get distant learners and in-person learners together. Counselors and office staff would be available online or in person as they feel safe. Cafeteria workers that feel safe to work in the cafeteria with the students can do so. Those that do not feel safe can provide to-go meals for distance students to pick up or provide to-go meals as at delivery sites. Save buses only for those that can't get a ride and then be socially distanced on the bus. Accommodate the bus drivers so they feel safe and are safe. Ask them. They have ideas too. All persons involved need to be considered and heard. All peoples need to feel safe and respected. This is a system for the future, not just for now. Think for future generations. This is our chance to make a change.
Thank you, sir. Almost called a 3-minute clock on you there.
I know.
Ms. Case is next.
This email is from Eric Klonch, and the subject is Let the Kids Go Back to School. Thank you for your service to your immediate communities and to Henderson County as a whole. I'm confident that the county is a better place because of your service. I'm writing you to request that you open the schools this fall with as normal a plan as possible. Perhaps wearing masks will help to make people feel more comfortable and perhaps even reduce the spread of COVID-19 virus, along with washing hands, not touching eyes, nose, and mouth. More importantly, the facts simply do not support the hysteria that some leaders in North Carolina and some in the media seem so determined to hype. According to a July 10th report from the Asheville Citizen-Times, of the nearly 120,000 people living in Henderson County, only 883 positive cases of COVID-19 have been found in Henderson County, despite rampant testing. According to a July 7th article from Henderson County, very own Blue Ridge Now, all but 3 of the 51 Henderson County deaths are from patients 60 and older, and only 251 cases have been reported in Henderson County for people less than 60 years old. This article also states that there's been 11,349 tests, which is roughly 10% of the county population. While I'm no scientist, this sample size appears to be large enough to reach some conclusions. All of you are undeniably talented and incredibly intelligent. Fortunately, this math is rather straightforward and clearly indicates the extraordinary low risk of COVID-19 to the roughly 14,000 students in Henderson County and to the teachers, administrators, and support staff charged with educating these kids. We should open our school system. We should embrace some semblance of normality. Our kids are watching and listening, and they are paying attention to the leadership in our county. We can open the schools, and we can do so in a safe and responsible manner. Certainly an option of homeschooling should be provided for those more fearful parents and for kids who are at higher risk due to their individual health situation. The rest of the kids need structure and support that only a regular school schedule can provide. They need their teachers in person. They need the extracurricular activities that make school fun. Learning at home on a computer screen will have long-term negative consequences that will soon become tangible and evident to all of us. And it could be in a form and manner that is heartbreaking. There may need to be small connect groups or a new club formed where the kids who are interested can come together and discuss their COVID-19 shutdown experiences. Extending the lockdown further by depriving our kids of a very close semblance of normality this fall would be the wrong thing to do. So I implore you as leaders in our community to open the schools on schedule as planned with as normal a schedule as possible. I share this with you as a parent of 3 kids who all attend Henderson County schools, with 2 of the kids riding the school bus 95% of the time in 2019 through 2020, and who will continue to ride the bus 95% of the time 2020-2021. Yours in service, Eric Klonch.
Thank you very much, Ms. Case. We have one last one from someone very familiar to us, and Mrs. Holt's going to read that for us.
So this is from Colby Corn. It says, "Greetings, board members. This is my first time addressing you from this side of the table. I come to you today not as a former board member nor an educator, but as a citizen of East Flat Rock concerned with the health risks posed by an asphalt plant being proposed just a few miles from Flat Rock Middle School and Hillendale Elementary School. This plant has the potential to cause serious health issues for students at both of these schools. This plant will run 6 to 7 days a week with large construction trucks coming and going from exit 7 along Route 25. Noise levels will be increased, but the true risk is that asphalt plants emit cancer-causing microparticles into the air. These are well known in the scientific literature to cause pediatric and adult lung disease, cancer, and chronic obstructive pulmonary disease or other brain disorders. Oily emissions have also been reported seeping into homes. The vulnerable populations are the aging and the young. In a time when you as a board are working tirelessly to ensure our students are receiving their education in the safest way possible, both physically and medically, I only ask that if given the opportunity to be heard, you voice your concerns to those making decisions about this project and the potential impact it could have on so many students and staff of HCPS. Thank you each for your dedication to the students and staff of HCPS and for always putting their health, safety, and well-being at the forefront of all your decisions. Regards, Colby Corrin.
Thank you, Ms. Holt, and thank you, Colby. We appreciate it. Before we move forward, I just want to let everyone know that's watching today that Mr. Jay Egoff is not here and will not be voting on any of our agenda items. And next up on the agenda is the consent agenda, and I will accept a motion when someone's ready.
I move that we accept the consent agenda as presented.
Do we have a second?
Second.
All those in favor say aye.
Aye.
Any opposed? Consent agenda is passed. All right, next up, we have old business, which we have none today. And we're going to move on to new business. First up is Dr. Jan King. Welcome.
Good afternoon, board.
Good afternoon.
Ms. Case teed me up pretty well to brag on Dr. Fry. You have before you the annual career and technical education plan that comes to you with lots of hard work. Dr. Fry's been working on this since about March, and you can see that in over 100 pages of data and goals. I would point out that, she's very transparent with our CTE program. And in addition to doing a great job with a limited budget, which she stays within so well, looking at places that we can grow. One of the things that she did this past year was write a grant and helped us get some additional staffing to start having that CTE, that career goal planning conversation a little earlier, working with our middle school students. So we now have some more support in middle school. Other things that you might see in there that are interesting, of course, are our apprenticeship programs, that wonderful partnership with Blue Ridge Community College, our CTE Business Advisory Committee. The support of this community around our students continues to be admirable and makes us all proud to live in Henderson County. And then, you see places in there where we have some gaps and where we want to grow, and that those are pretty reflective across the board in our other areas as well, not just in CTE. But again, she's got those goals laid out there for the next year. One thing, if you compared this to the plan you saw last year, that you'll notice is different is that the state did away with our testing, of course, in the spring because of COVID. So you don't quite see all of the data you've seen in past years because we don't have that data to report to you. If you have any questions, I'd be happy to try to answer those. Or if I can't answer them today, I'll pass those along to Dr. Fry. I know she'd be happy to answer them. But we're proud that she's our CTE Administrator of the Year for the region.
Absolutely. She is amazing. And every year I read this 110 pages. And I think this is a light one, honestly. And I'm amazed by what she puts together and like you said, her openness to where we are deficient. Because it takes that understanding to be able to see where you're not doing well to actually improve.
Absolutely.
And it's kind of piggybacking a little bit on what I was talking about last month in this boardroom. But kudos to her. I don't have any questions on it. Open it up to anyone else.
Is there any way we could put CTSOs in the middle school? because that's where they're excited about stuff, and maybe put that in with the lead program.
I can definitely ask Dr. Fry about that. I don't know the legality of CTSOs being in the middle school. And for anybody listening, a CTSO is a career and technical student organization. And lots of us in the room participated in those in high school, the leadership opportunities, the public speaking opportunities, the presentation and competition opportunities. So we can definitely, I'll follow up with her about that.
Because that's where kids, if they're not sports or they're not academic or they're not in student government, the lead would give them another outlet there to encourage the CTOs, and that would help high school when they come to high school about the programs too.
Absolutely.
And could the CTEs have a website to post those jobs that are available? That was one of the things that you said you was going to work on or something.
We do. We have that up and running, and our students actually get to directly apply. If you'll notice on any email from Dr. Fry, even it says, post your jobs here. The one caveat, if any community members are listening, that we do make sure it's a job that meets all EEOC requirements. So we don't post like if you need help in your yard, that kind of thing, and they have to follow tax laws and all that. But we have some students who not only have applied, but landed jobs that way.
And could that be given to all teachers? Because some kids have CTE first semester, but they don't second. And if they were those jobs and they were posted for all teachers, and sometimes they just get posted, I think, with the counselors, and, maybe if they got posted with the teachers, it could be more widespread.
Maybe elevate that more, certainly, yes.
Okay. And then when they have the 8th grade coming up to rising 9th graders, could CTE teachers be taken down there because they're more excited about their courses and they know more about them than just, the counselors and somebody going down there, and they might could perk up some kids to take the CTE courses and be familiar with them.
Absolutely. And I don't know how much of that's going on in our traditional high schools, but I know this past year, for example, Chief Barnett from the Firefighter Academy went around and did some recruiting. We've done that with the culinary program, but I'll talk with our principals about trying to make that middle school to high school connection a little stronger.
Okay. And could the apprentice recruitment, I'm just so sold on that program. Could it be, and parents, I'm telling you, high school kids do not take home any messages to parents. Really? Insurance papers, whatever's under the desk, never gets home. Could we maybe push that down and let parents know that maybe in that 8th grade orientation thing, that this is going to be available when they're seniors, and just give them a heads up about it, and maybe start that recruitment program and every year sort of build it up, somehow.
That's a good point, Ms. Case, because our first year we did struggle to get the word out, and we've resorted to multiple methods now of trying to get the word out, because as you said, the apprenticeship program, thanks to Dr. Fry's leadership and our partnership with Blue Ridge, has expanded. It was initially just advanced manufacturing. And now it's expanded to trades. It's expanded to banking and finance. And so we do see a lot of opportunities with the apprenticeship, and it's a full ride. It's a job and a full ride. I mean, it's wonderful. So yeah, we'll continue to try to get that word out better to parents, because you're right. Sometimes it takes that nudge.
Yes, because when they had those ceremonies, every kid, I went to two of them, and every kid had a parent there, and probably never been there before because their kid's getting something. So, if we can somehow bring in the parents to this at an early stage. Are there any summer programs for middle school? We have like that one with the girls last year. And I mean, this summer's off, I understand, but maybe have some summer camps with CTE to sort of give those middle schoolers a taste of it, because that's where the excitement is about everything is
It
in middle
is.
school.
Our camps have been high school camps. And Blue Ridge has offered CTE type camps, but I'll check on our capacity to offer those for middle school. Of course, another summer besides this one.
And I've talked to Wendy about some things in her report, and Mr. Fender is in here, and she just gave you all kinds of praise of how much you help out with the CTE program. And she says the whole county administration is so good about the CTE program. And so y'all, I'm glad y'all are in on that.
Well, she's our CTE queen. I don't mind saying that. Absolutely.
That's all.
Any other questions? Thank you, Dr. King.
Thank you.
Next up is going to be
It does
Dr.
need an approval if you
Oh,
want.
we need to approve
have
that.
to,
Yeah, sorry.
yes,
I was
have
going
it
to take them
approved
all at
today.
once.
Thank you.
Thank you for,
Thank you.
I will accept a motion.
I move that the Henderson County Board of Public Education approve the Career and Technical Education Local Plan as presented.
Do I have a second?
Second.
Ms. Case? All those in favor say aye.
Aye.
Any opposed? Motion passes. Now, Dr. Bryant.
Come, stay a while.
Mr. Policy.
Mr. Policy.
I am confident that you all missed long lists of policy. Everybody had been disappointed so I'm reprising my role in policy presentation, but I will give a little prelude to that as we prepare to look at each of these policies and let you know that actually you're looking at only a series of required policy updates in the first series, and then the longer list are simply technical revisions, cross notes, foot references, those types of things. And so it's not as in-depth as it might appear. At the suggestion of the superintendent and the board chair, we removed those because we felt like there were more pressing matters for us to consider new policy and new policy adjustments a little bit later on. So if you are grateful for that, seeing this revised agenda, say thank you to Mr. Craven and Mr. Caldwell. They were those who did that. And if I might, before I speak to the first policy, just in speaking about how outstanding the group of people that we all work alongside every day are, we learned late on Friday that Molly McGowan Gorsuch, our public information officer, received 2 Golden Achievement and 1 Honorable Mention awards from the National School Public Relations Association. And so since we're not necessarily doing recognitions right now, if she were here, we of course would call her up and embarrass her and
Take her picture.
make somebody take her picture and then give her a photo from her own camera, those types of things. But she is an exceptional public information officer, really respected regionally and in our state, as you know. And so I wanted to share that good news with you guys as
Awesome.
well.
Thank you.
Yes, absolutely. All right, so with that in mind, spring policy updates. And I want to share with you a little bit about why spring is just coming to us now. Normally, we would see policy updates in April or maybe even May in a normal sort of board cycle. But of course, in that period of time, a lot was going on in this state. And the state board, especially as it related to the School Boards Association, who brings these recommendations to us, was attending to all the legislative changes that were happening at that time. So they kind of put all those recommendations on hold, wanted to make sure that policies were matching what those elements were, the changes that were coming from the General Assembly and from the governor's office. And so that's why we're bringing these to you now. We got these just a little while back. So first and foremost, you'll see Title I, Parent and Family Engagement. There's an update to that policy as it relates to Agenda Item B. I'll read to you briefly here. You see that there's an updated section about parental notices. That's the most substantive change as it relates to that in Section E, and it's intended to be consistent with the new regulations with regard to the Every Student Succeeds Act. And then, of course, you have updated footnotes. I'll be glad to answer any questions you might have specifically about that policy update.
Questions,
All right.
comments, concerns?
Nope.
Next.
Would you like to take these one at a time or as a group, Mr. Craven?
Let's do them as a group.
As a group? Okay. So the second policy is 3460, and that's dealing with graduation requirements, and specifically with regard to the graduation requirements. And I'll draw your attention to the summary request. There was some eliminated data here because in the 9th grade class that had entered in 14-15, those students have presumably graduated by now. So that information did not need to stay in policy. There was additional graduation requirements that are for the rising 9th grade students to reflect the change in the social studies credit requirements. And then they updated the charts that were central to that to be consistent with state law, state board policy, and then also updating hyperlinks. And then again, eliminating NC final exams after the current year, and then updating legal references and footnotes as well. So in short, this graduation policy changes as cycles of cohorts move in and there are new requirements, or they're eliminated if the cohort requirements are graduating out. Be glad to answer any questions you might have about 3460.
I don't have any questions, but I'm gonna beat a dead horse right here.
Yes, sir.
I think it's a really good idea that we are finally bringing the economics and personal finance course
Yes, sir.
To our schools. I think even myself as a financial advisor, I didn't know enough about finances to not get myself in trouble my first year of college when they were handing out free T-shirts if you signed up for a credit card.
Mm-hmm.
because those credit cards looked awfully enticing when I was broke those last few weeks of college, and I took them. But to eliminate a social studies
Yeah.
requirement for that is just
Shame.
how in the
That being
world?
U.S. history.
Right, it just doesn't make sense to me. It's just crazy.
Fought for years and years to try to get a second U.S. history unit and
Yeah.
because, and then finally got it and now it is.
You know, if we could have put it into an elective, I mean,
Yeah,
it is
like
actually
mandatory.
math. Just to eliminate the social studies. Anyways, just wanted to beat that dead horse, but I don't have any questions on this. Does
And I
anybody-
appreciate you bringing that to light, but for anybody that's watching, I would remind them, as you've done already through this board meeting, that's not a local decision.
That
was a state
thank you,
decision.
sir.
That was a state decision. We are not making a recommendation here because this board has suggested that. We are simply revising the policy to match the legislative requirements.
So for years, they're going to be going, why doesn't my kid know more U.S. history? And that's going to be in the paper slamming education.
So I don't know why this didn't occur to me before, but could we make a local decision that one of our electives is a mandatory elective of a second U.S. history? I don't know why that didn't cross my mind before, but
Well, much like the board, for example, requires more credits than
Right.
is in state policy as a minimum, the board can set local graduation requirements. Yes, ma'am.
I think we should seriously look at doing that.
Make it an elective.
But a mandatory elective, like PE and health is an elective, but you have to have it.
PE separate from the
It's
electives.
not an elective.
Yeah.
It's a required
Required
course.
for graduation.
Yeah.
Right.
An elective, you get to
Ninth
pick
grade health
between
and
anything.
PE.
PE, right. Yeah, but it just be something that we add in there.
And increase graduation requirements.
This board didn't like that too long ago with,
I think it's very well worth discussing, but I think there are lots of,
Well, and you also know they just passed saying that they have to have an arts credit to graduate.
That's coming up. I
That's
think
coming up.
we'll talk more about this during the general operations when we talk about the legislative updates, and Dr. King will certainly talk to you about all of them. If the board would like to discuss this, I think what we need to do is we can bring you the facts about what it would take to do this, because you're also looking at personnel, the number of teachers you'll need to hire, because I'm just thinking out loud, but Mr. Rhodes, I'm looking at you, it would require additional social studies personnel. So it would not only be a financial decision that we would certainly bring to you as a discussion item that you could look at and what it would look like and how it would look, if you would like for us to do so. I certainly know.
Electives are in the graduation left after they have the required courses.
Dr. King, I'm going to turn it over to you. You know them very quickly.
So if you're on a block schedule, you need credits, and there's only 22 state requirements. You're at Hendersonville High School on a year-long schedule, 4 requirements. They only have 2 electives. That's for the minimum diploma. A lot of our students get many more than that. Most Hendersonville students graduate with a full 28.
So, and you required four English?
Yeah, you can only fail 4 of what you were eligible to.
So mathematics, you have 4.
4 English, 4 social studies.
Science 3.
3.
So you're looking at, as a board, you would say that they would have to have 5 social studies to graduate
They would
then.
have more, if you did that, they would have more social studies.
We
so
can
it's-
we'll bring you let us confine this and we'll put it on the agenda if you'd like to have a further discussion.
I think it's worth looking at.
Right, and just for context, as Dr. King was saying, current board policy is 4 fewer than are available to you. So again, if you're on 4x4, 28. If you're on the 7-period day, 24.
All right, yeah, let's put that on the agenda. We'll take a look at it. All right, moving on.
Okay, and we'll look at 4110 dealing with immunization and health requirements for schools. And again, this is simply to update the vaccination requirement. This includes a booster dose for MCV. I won't even attempt to pronounce that incorrectly. That it's dealing with students entering the 12th grade August 1st, 2020. So that is this rising class, as you might take a look at, or have reached the age of 17 by that date in accordance with the state immunization requirements. And to the credit of our health department, even in this current time, they've been working closely with Dr. King and our leadership team that if we needed to support that new health requirement, that they'd be willing to do so. As with all immunization requirements, you have within the first 30 days of school to complete that requirement before it would not allow you to attend school in a face-to-face environment. But I'll
They
be glad.
come out to the schools and give the shots?
We would work on something that was what the recommendation of the health department, whether it was doing at the schools or is doing at the health department or otherwise, kind of depends on our community health right now in terms of where they do that and how they do that. But they would work with us on that.
So kind of like they do the flu, they might be able to do that. That
Yes,
would be
ma'am.
really neat.
Glad to answer any questions about that. If there are none, then you'll see 7241, which deals with the drug and alcohol testing for commercial motor vehicle operators. And again, it revises a paragraph specifically to clarify the prohibition on post-accident alcohol use by a CDL holder. And you can see that information listed in there. And it deals with the restriction on such use after an accident. Glad to answer any questions.
Yeah, so it's one of those unenforceable policies that you add in place. And what we're adding in is no driver may use alcohol within 8 hours following an accident while operating a commercial motor vehicle or until undergoing a post-accident alcohol test, whichever occurs first.
And for our purposes, where I would say that that's in line with our current practices is if you're a CDL holder and you're involved in an accident, you have that test
You
immediately.
have that test immediately,
So that
absolutely.
second half of that clause is we don't wait
Right.
6 hours, 8 hours, 12 hours. You're actually taken immediately
Yeah.
for that test.
I just think it's funny, like you can't use alcohol till 8 hours after you get in that accident. It just seems so arbitrary, but
Right.
I would prefer something, you can just eliminate that until you take your post-incident.
Well, I think that's in order to sort of make the policy work for all school systems, regardless of sort of what their practice is. As I was saying, our practice is such that if you were driving a school bus, for example, which is our CDL holders, and you were involved in an accident, you're going for that testing
You could-
right then.
You could qualify, you could solve that if you said 8 hours after or until you have the test, whichever comes first.
Yeah, that's how it reads.
That's what it says now.
Okay.
Yes, ma'am.
Or until.
That's where I
I
was
just
sharing the
read
second
that.
half is maybe more important than the first.
Yeah.
half.
Yeah, it is.
I just
I just saw
read
the 8 hours
I
was
just
like,
read the 8 hours too.
Yes.
okay.
It does say whichever comes first.
That's all I've got on that
Okay.
one.
Any questions about those specific updates? Again, B through E.
All right.
If there are none, then I'll just again mention in short, F all the way through Y, if you'll note there. These are minor changes. These are considered non-substantive, and they are changes to wording, legal references, cross references, hyperlinks, footnotes. So
Situation.
punctuation, thank you, sir. And so again, just what we would consider to be technical changes only. There is no content that's being changed. Policy is not being adjusted. There isn't anything that was in the policy that now isn't in the policy. They're just updating the information.
Does anybody have any questions on F through Y? It's pretty standard procedure. We're gonna do that twice a year at least.
Yes, sir. Fall and spring.
All right, if there's no questions on those, I will take the whole lot, B through Y, when someone's ready to make a motion.
I move that the Henderson County Board of Public Education approve policies starting with item B through
Why?
item Y.
Do I have a second?
Second.
It's Mr. Wood. All those in favor say aye.
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 Any opposed? They are approved for first reading.
Does our policy require first and second reading? I mean, it seems like this is ridiculous to have a second reading on technical changes.
Yeah, that's
It
his.
doesn't. Actually, your policy manual says that if it is a change to just conform with general statute or some kind of other clerical change, it doesn't have to go through 2 readings.
I think the technical ones, like the F through Y, I think it is a little bit.
So
Monotonous.
can I make
Amend it?
another motion since we've already voted on that one?
Yeah, you could make a motion to waive an
To waive
additional
the second
read.
reading on
waive
F
second
through
reading.
Y?
Sure.
I'll accept your motion.
I move that we waive second reading on policies indicated in F through Y because they are only technical changes or punctuation.
Do I have a second?
Second.
All those in favor of that motion say aye.
Aye.
Any opposed? It's approved.
Thank you.
Thank you. You saved us about 5 minutes for next meeting. All right, so let's get into the fun stuff. Mr.
Yes,
Bo
sir. The
Caldwell,
fun stuff.
All Children Today report.
All children today. Before we start that, I just want to go back and just remind myself when I was in Dr. Bryant's shoes and we did not have this policy manual. Mr. Campbell would say, you need to have this, and this required changes in your policy. And I have to whisper, we don't have that policy in Henderson County Public Schools.
I've looked through that book.
And Mr. Campbell will say, you need to get the policy. And I said, well, due time, we will do time. Man, look where you are now. In one swoop, you just all of a sudden approved those policies that we didn't have in Henderson County. So thank you, Mr. Campbell.
Thank you.
John Bryant talks about it quite often. I won't tell you about the language he uses when he talks about that. He talks about it quite often.
We've kept him from being bored the last.
Yes.
Has it been it's been 2 years, hasn't it?
It
It's-
feels like it's been.
It's
time.
as Dr. Bryant, it's an adventure. How's that? Let's talk about all children today. We've got to act. And I think that our first act is to listen. I think Mr. Craven, you said it best, is before we can do anything, we need to listen to our folks. And so I've presented with you a staff focus group that we are going to talk to this week. Unfortunately, the way the 4th of July felt right on the weekend, some people were on vacation the week before and some people were on the vacation the week after. So for us to get the majority of these people that we're going to have a focus group and we're going to ask just a couple of questions and just listen. Before we can start doing anything, you've got to listen to understand. So I just wanted to bring you that for your information that we have a focus group with staff. We'll certainly continue this group and also certainly add other groups. This, if you can see, represents different groups of people. Certainly from different age, from different districts. We try to encompass as much as we can throughout Henderson County. So this is our first step in what we feel like is what we need to do for equity, is to listen first. And that's what we want to do this coming week. Okay? Any questions about that? Good. Construction update. Dr. Bryant, you can just sit right here.
Just want to share some quick information with everybody as we relates to how we operate moving forward, especially with the construction. Many of those partners who have been helping us finish up projects at Edneyville Elementary, the work that's happening at Rugby and Flat Rock, and then of course Hendersonville High School, which you see continuing, they're on pins and needles as well, waiting to hear what's going to happen moving forward. Our relative focus right now is to get as much of that work done as the summer continues, to make sure that we're putting a button on those things and to continue to share with you guys in the August meeting kind of where all those projects stand, especially as it relates to scheduling around school and what school might look like. The update really is a focus to say thank you to each of them right now, because they have been tremendous partners with us, because they have worked as the uncertainty has been around what we know, and when we sit down with them and say, we're only sure about what school might look like for the next 2 weeks. And so we need you to work within that 2 weeks, or here's what it's going to look like for the next 2 months. And that really has been it. I know folks that are in that industry would certainly understand that, but they have all been great partners with us. And so we're really proud to report that we fully expect, of course, that we've got a couple of projects that are coming to an end this summer as it relates to the work going on at Edneyville and the work going on at Rugby and Flat Rock. But we're going to continue to stay as aggressive as we can at Hendersonville High School while time allows. And then as soon as we know what will be happening for our students moving forward, we'll share more with you about what that looks like, because Hendersonville is going to be an equally critical thing for us to communicate. As soon as students are back on that campus, we're going to have to share a lot with them and with the community about what that's going to look like. So we're continuing to plug along. Every day we get weather like we get today, they remind me they get to get a lot done. And so I'm grateful that we just kind of have these summer showers coming through, because oftentimes that's really letting us stay ahead of things. And so just wanted each of you guys to know that. I know normally in the summer you don't get that kind of update, but the last thing that I'll share is July 1st, of course, turned over our fiscal year. So the capital projects that you approved in our budget, namely like the roofing and the other, those have already gone out to bid. We're already beginning that particular work. So the capital projects that are a part of this fiscal year are already beginning to be greenlit as well. Okay. Any questions about that specifically? All right.
You can just stay there if you don't mind, Dr. Bryant.
Yes, sir.
We're going to talk reentry. Dr. King, if you don't mind, if you would come down, I'm going to switch it up just a little bit and let her go through the legislative update, and then we'll certainly talk, or Dr. Bryant, you could go there. Let her talk about the legislative updates as far as what's happened here, as far as the General Assembly, and then we'll certainly then get to reentry.
Thank you, Mr. Caldwell. Two updates that have kind of been alluded to already in this meeting that I would want to make you aware of. In February, we walked through our high school social studies teachers' recommendations for how we would implement the economics and personal finance class. And our high school administrators and social studies teachers wanted to go ahead and push that towards an upper level class requirement because of the nature of dealing with money. At the state board meeting last week, they have delayed implementation of the new social studies standards. So let me tell you what that means for us locally. It means that in K-8, this was going to be our transition year to learn the new standards, and it won't be. So there's no change in K-8. And in 9-12, because of the plan our teachers had recommended that we all felt pretty good about, we won't feel a change at all. So you might be seeing a lot of headlines about a delay in the standards. For us, that won't change anything with student scheduling. But part of that delay has to do with the content and the feedback of the standards, and they were just simply not ready to roll out. I think the national conversation around equity and equality and wanted to make sure that the standards reflect what they should reflect moving forward. And so there is a purposeful delay there. And then the second piece is that arts requirement. This was a General Assembly action beginning with the incoming 6th grade class of 2022. So the current 5th graders, students who are going in 5th grade, will have to have an arts requirement to graduate from high school. And that requirement can happen anywhere from 6th grade through 12th grade. We are waiting on guidance from the State Board of Education to understand exactly what constitutes a requirement. It's easy to understand, for example, in high school that a band course or orchestra course, theater course, visual arts course. What we don't know is right now in middle school, some of our students might take a 9 weeks of theater or dance or something. Yeah, and I don't think they'll count that as arts, but we'll see.
Well, they're only doing the 9 weeks for each of those
yes,
classes.
They're rotating. That's right.
They're rotating through.
And we don't know if that counts. So we'll know more, and thank goodness we have time. It's a delayed implementation. I will say many years ago, and I want to say, if my memory serves me correctly, it was 2010. I was on a state committee looking at adding an arts requirement to the state graduation requirements. And at the time, the holdup was money. It was funding. And if you add a requirement, how do you have enough staff to make sure that you can schedule that requirement? And they looked at the percentage of students statewide who were taking an arts course. We can look at that locally here to see the impact, but we're kind of holding off till we hear more about what exactly will count as that course. We have a lot of our students who currently take some arts course between 6th grade and 12th grade. So more to come on that.
You might not be able to answer this, but if they did take the course in 6th through 8th grade, would that then transfer as a credit, or would that count towards GPAs in high school?
I'm going to pull out my I don't know shirt. Right now, if we offer a high school full credit course in middle school, then we can count that course as a credit, but not in their high school GPA. So it would probably follow that same guidance that we currently have, for example, English 1, Math 1, Spanish.
Okay.
But I don't know yet.
Okay.
You know, our CPR requirements there as well. Our students also have to graduate with CPR.
Right.
But it's just a checkbox.
Yeah.
Did you take CPR? And so we don't know yet what the reporting is going to look like. But it will be a requirement for our current 5th graders.
Those two, I
Unless
wanted
they
to
change their mind.
Yes, ma'am.
Yes, Dr. King, just stay right there.
Okay.
Yeah, I just appreciate that because you'll see those. I think that COVID and reentry has taken precedent over some of these major decisions that were made that right now are kind of being slipped. So I wanted to certainly bring those to your attention. And Mr. Craven, if you look at me, there is an art to good cooking. I'll just tell you what.
To me,
I do agree with that
a lot at my
statement.
house, and it is an art.
Yeah, you can
Making
tell.
sugar
Yeah,
things.
exactly. You
Me
can
and
tell by
that's where you're speaking.
you can tell by my physique that there is an art to good cooking. Let's talk about reentry and what I would like to say first is that I'm hearing that the governor might make a decision this week. I know your schedules are tight, but here's the way I would like to handle this: is I'm not going to present you 3 plans today because I'm not sure it would take a pretty good length of time. What I want to do is once we know the plan. And here's the plan, then we will present that plan, and then we can present other plans because you're right, Ms. Holt. If he says that we're going to be on plan A, as a school board, you have the right to say we're going to go to B or we're going to go to C. If he says that everyone's on C, you as a Board of Education, of course, can't go the other way unless you make a decision, and certainly then you can defy the orders by the governor. What I want to do is walk you through some plans, but then is put a formal approval is I want to do it the day after because this is what the plan is. This is where we are, as you stated. Here's where we are. Kind of tell you what we're looking at for A, for B, and for C, and how it's going to look. Ms. Holt, you also said it best. And we need to continue to get the word out. This is not Amy Lynn Holt's decision as far as what plan we're on. It's not the school board's decision. It's certainly, as I get the same emails or I may get different ones, when are you, it's not the superintendent's decision. There's the governor with state health officials because we've talked about this is a health issue. This is not an educational issue. We can debate whether we need to add a social studies class if that's what's best for children. We can debate that. Economics class. We can have those discussions. This is a health issue. I called Steve Smith today and I said, Steve, just want to let you know from the Board of Public Health and from the health department, we start getting into this. We're in this together.
Right.
We're in this. And Steve said exactly what I knew Steve would say. He says, absolutely. He said, I'm not behind you. I'm beside you. Because this is an education/health issue.
Yep.
And so once we get ready and once all of a sudden, if the governor says, I'm going to make this announcement on, let's say Wednesday, then I'll call Mr. Craven and I want a meeting that very next day so we can let the parents know. We can sit here and talk 2 hours on Plan B. I can tell you everything that's wrong with Plan B. I can tell you everything we're going to have to go through. I'm going to tell you everything that will change with Plan B that will absolutely turn my hair gray. Watch it, Michael. There's no need if we're not on Plan B at this time, unless you as a board makes a decision to say, well, I think instead of being on A, we want to go B, and then I'll present B to you and you can approve B. Do you see my logic here? I do want to spend time today, and I've got these two here and Mr. Rhodes in the back, because it deals with operations. It deals with education, and to be honest with you, it's going to deal with staff. Right now, I want to tell you, right now in Henderson County Public Schools, there are items that we can't get done because we have personnel who are basically quarantined because they have COVID. It's in our departments. And I am 99% always a positive person. But I want to tell you, we are going to provide the safest, the healthiest school that we can. But you're going to hear, once school starts, you're going to hear that we will have a child with COVID. You're going to hear we will have a staff member with COVID. I'm just going to tell you right now, and maybe I'm wrong, and Mr. Campbell, you're my attorney, you may be looking at you and say you need to stop right now. but it's inevitable. Don't you agree?
Absolutely.
It's inevitable. It's going to happen.
And I think you're right. I don't think we need to start debating A, B, and C now until we have some sort of mandates. I think this board, we waited to send out that survey, and I think it was smart to send it out, even though he didn't make his decision, because parents need to know something. I think the more we talk about it right now, the more we're going to confuse folks. And I think we need to wait until the governor comes out Wednesday or whatever it is. We'll set an emergency meeting. We'll all get back in here, and then we can talk about what A, B, or C
Sure.
or combination looks like. I just don't see anything. It just doesn't seem to me to have any positives to start debating
Right.
where we're going
We don't know.
right now.
Well,
Not even debating, just
And Mr. Craven, Dr. King and I even talked about, we continue to want to let parents know there is an option. I think one of the letters is give parents an option. Ms. Holt, you said it so well, is parents, it's a parent's choice. And if as a Board of Education, it is Plan A, and we're all back together, and you as a parent, you say, look, I just don't feel like it's ready for my child to go back to class. We are providing those parents and families an option. And we need to we'll continue to have Molly get it out there. We'll continue to push that. We talked about, do we start registering for that? But yet, what if we're on C? It does us no good, and now we're confusing folks. So, and so therefore, wait a minute, I signed up for this, but everybody's on this. So therefore, we are all engines are go. We're just ready for the flag to drop, and then we're going to sprint around the track.
Do you guys know preliminary results from the survey? Like if half of our population said, and I hate to even use that because I know there were people taking that survey that their kids are graduated and gone, but
Yeah, do we have any
results of
survey
that,
results?
Yeah.
Yeah, the survey closed Friday night at midnight. And so Molly and Dr. Bryant and I were communicating earlier today with Mr. Caldwell, and we're going to be putting out through our Return to Learn updates some results to share with families so that we can be very transparent about what came about and the feedback that we got through the survey. And of course, those surveys were not asking for specific commitments yet, much like you're talking about. We're not to that point yet. We don't know what reentry plan. But in terms of sharing with people some of the comfort level among parents and students, we can certainly share those.
Can you do that now?
Yeah, can we?
I don't know them off the top of my head. Do you? I don't.
Do we have any of that stuff?
Y'all like numbers, and I don't.
I do.
Look
I'm
at
a
me.
numbers
Look at
guy.
me.
Can you send them later or
Can
something?
you just tell us what percent of return you had on the surveys?
That was-
Like 90% of the surveys you sent out, you got back, or no?
The last time I looked at it, which would have been, I was going to say it was 7,800
surveys.
yes,
half.
responses.
Oh, well, then that could be one parent for several kids,
Well,
right?
that was me for 3 kids.
Yeah.
So
Right.
While Dr. Bryan is looking those numbers up, we also, to be honest with you, and like I said, the concern is we keep talking about children, and yes, it's the staff.
Yeah.
Because that's because the issue is if we're back, but
Who's gonna
yet
teach
now I have a staff is all of a sudden how many staff? Now, we also did a staff survey.
Right.
And it's talking to teachers. And Mr. Rose, while Dr. Bryant's looking up some numbers, what about your staff survey? Kind of just move a little
need to get you
closer.
to a microphone.
Yes. Come take this seat right here for Dr. King and give us some update on some staff surveys that we have done.
He's already got to pull it up on this.
Here's this us talking and asking.
To be honest, this is what keeps me up at night. I think I've memorized it. I don't even know what to be honest. So,
So these are staff survey results. So
yes, sir.
everybody's,
So we surveyed our staff, Mr. Craven, last week. We have 1,417 responses. And looking at trying to get some information about how comfortable our workforce would be in coming back, which reentry plan would they most be comfortable with. We had 41.2% who said a face-to-face instruction with safety protocols in place, 35.8% a hybrid model with some face-to-face, and 23% selected a 100% remote online instruction through HCPS.
Wow.
We also asked the question, if state and local public officials believe it is safe to allow in-person instruction with social distancing measures in place, how comfortable would you be in returning to school this fall? Comfortable with minimal or no concerns would be 33.4%. 55.1% said they would be somewhat comfortable, but with concerns, excuse me. And then 11.5 would not be comfortable at all.
What is, it's like 11 and a half of our,
You're looking at about,
at our, yeah.
I don't know, 150
Further.
people. Well, 150 of the people that responded.
The one question that we asked, and we had to be very careful in the way we posed this, and we actually copied and pasted this from the ADA guidance that we received so that we wouldn't be breaking any HIPAA violations. That we asked, in the event we have face-to-face instruction, would you be unable to come to work because of any of the following reasons? And so those reasons were if you were to be high risk, if you had childcare issues, transportation issues, and I think there may have been one other that was listed. And that number, 35% said they would have an issue. Now, it's difficult to be able to discern out of that 35% how much of it is high risk, how much it is for childcare issues. And so, but the concern is, again, with our workforce is looking at once we do report back, right now on a small scale of working through the summer where we are having folks who have tested positive, and then the people that have had contact, and then for them to have to go into quarantine of what that may look like. And so we've been working with Mr. Campbell and Shadley and their folks and trying to make sure that we're looking at giving our employees and following the guidelines from the state about where we have employees who may be high risk, the ability to self-identify, to be able to ask for accommodations if needed, and looking about what those reasonable accommodations will be, again, will be an opportunity for us to work with our legal counsel as we work through those. You know, obviously trying to give teachers an opportunity to work from home, you know, and be able to do Classville. There are a lot of problems that come along with that. As far as having to put a substitute in the classroom and then you're double paying. So there are a lot of challenges that we have before us if we are on plan A or B. But those were the survey results that we sent out from HR just to kind of gauge where we are at. If we need to, and Mr. Caldwell thinks we need to send out another survey, then we will be happy to do so if we need to get more information from our employees.
And I certainly, Mr. Campbell's been a great resource. And in fact, he came early today and we talked about a couple of, especially employee issues.
Yeah, that's, I mean, all students, everything worries me, but that's the part that's not, of course, we've all thought about that, but the public thinks we're not. Like, we've got to protect our staff. And, you know, when you talk about just that quarantine issue, I mean, that could mean an entire school shutting down, having to quarantine because there were
Or multiple schools.
two people. Yeah.
And Ms. Holt, right, and on Plan B, and you have two children and you're a teacher and your two children are with Group 1, and Group 1's time to be in school, that's great, but now Group 2 is coming. Now, what do you do with those students or your own children because they're in Group 1? I mean, like I said, we as Mr. Craven said, I'm not going to sit here and I could talk. We could bring in dinner and keep talking about the three different plans. And I don't want to get into the weeds with the three different plans. I do want to let you know before he brings the survey, what's sometimes kind of frustrating is also what we're getting from the CDC and North Carolina DHS. It's constantly changing. So once you make a plan,
Conflicting from
or
one organization to
conflicting
the other.
Exactly, exactly. Now, people think that the transportation is all worked out because they removed the 6-foot social distance from buses and allowing us to put one per seat unless they're family members, and now you could go 2 per seat. Now, I still want you to go back, and Michael, I know that you had some previous experience. If you're bringing in a bus that had 2 and 3 to a seat, and now you can only go 1 to a seat, I want you to just simply do the math, okay? If there were at least 2 to a seat, and you can only do 1, so now you got to do double routes or triple just for that one run. And then if that bus does double runs, then it could be up to 4 to 5 runs, or maybe even 6 runs for one bus. You'll get kids in there at 10:30, and then they'll have to leave at 1:30 to get them home. And then we have a large percentage of our children, our bus drivers who are I wish they were teachers. And now the problem is where do those, who's watching those while the teacher's on the bus? once again,
With
this is-
temperature checks.
what we did Thursday, and I just, once again, as a Board of Education, you're so blessed to have a staff such as this. But we went into a media center. We started at 2 o'clock on Thursday afternoon. Luckily, we did a Chick-fil-A run and we kept going, and it was probably 8 o'clock when we left. We spread out all over the media center at North Henderson High School. And what we did is we took a student, we took Billy, and Billy on plan A, let's talk about Billy. Let's talk about Billy entering the building. What is it going to look like when Billy goes to the front door? What does it look like when Billy gets on the bus? And we followed Billy throughout the day. And then it's almost a flow chart. What if Billy's temperature is this? Where does Billy go here? What if his temperature is good? Where does he go here? Do we have coverage? This is what we started making the plan. Now, you know school. We can make a plan with some descriptions, but in reality, there are going to have to be 23 plans because Atkinson is entirely different than Flat Rock, which is entirely different than North Henderson High School, which is going to be entirely different in Hendersonville during construction on how the kids look where they come in. So therefore, once we meet as a board, the very next day, we're bringing in 23 principals face-to-face, spreading them out in the largest room we can get. We're going to keep 6 feet apart, but we've got to talk about the day-to-day process on plan A or plan B and or plan C on what it looks like on how the principal is going to handle, i.e. Billy, and we're going to take Billy throughout the day. We're going to take Billy through operations. We're going to take Billy, okay, what if, and unfortunately, does Billy have a teacher? Could Billy have a teacher? We're talking about right now, if Billy's temperature is over the 100.4, where does Billy go? And then if Billy has a second check, where does Billy go? Then how does Billy get home? Does he have a ride? Does he not have a ride? If Billy does have a ride, family members come back. We've got to be prepared to talk to that family and give them a piece of paper because, i.e. parents, Ms. Holt, Mr. Craven, you get the call that you got to come pick your child up because your child has a temperature of 101, and you're going to say, what's next? What do I do now? When can I bring the child back? How long does it need to be? Do I need to go get the child tested? These are things that we're going to have from the health department to be able to hand to you as a parent, as a family member, to know exactly what needs to happen. If Billy passes the temperature check, then like I said, Billy throughout the day, how does Billy get home? Those are the things that we've talked about as far as schedules. Classes, we're through the work of Dr. King, if we're on plan A and plan B, we're looking at classroom numbers, social distancing. You remember A is we're going to try to do as much social distancing as possible. But if A is everyone's in there, there's got to be some things that we've got to look at. I just asked Mr. Campbell, I need some help about band class. One band teacher, 50-some kids in a class.
Blowing through instruments.
Blowing through instruments. If we're on plan A,
And they dump their spit out of
Oh,
the.
I know. My son
Emporium or
shares a
whatever
French. My
it's
son
called.
shares a French horn.
French horn. We're on plan A. What do you do about, there's some classes that we've got covered. We're looking through CTE. Shop, sharing equipment,
Let's
not
be
sharing
honest.
equipment.
Football, and sports coming up too. We've got a lot of stuff that we have to. think
We've got a
about with
lot of
all
stuff that
this.
we've got to work through. But like I said, I just want to let you know the work that we've done. I don't want you to think, well, he's not ready, or we're ready. We're ready. Now, do we have 100% of the answers? No. And to be honest with you, I think we'll still be building the plane while we're flying it on August the 17th, because I think the flight plans are going to change 2 or 3 times, even before we got our ticket to get on the plane. And once we're there, they're still going to change. The biggest, I guess, issue or announcement or whatever we need to say is we're going to give family members a choice. If we're back face to face, plan A or plan B, if they're uncomfortable and not ready, we have an option for them. And until the state makes a decision, until the state tells us whether it's a statewide, whether it's regions, whether it's locally as far as individual, then once we're handed that, then we'll come back together as a board and we'll go through the process. Now, I'm sorry, Dr. Bryant, you had some numbers that you were looking at.
Need not apologize. Yes, sir. As Mr. Call was saying, there's been a tremendous amount of preparatory work that's been going on that he's been leading. Cannot emphasize enough of the amount of behind the scenes action that is going on in terms of our preparation. I do have to give a quick correction, I said 7,800 as I was walking to my computer. I was having a policy flashback. It's 7,400 respondents to the parent and family survey. 7,415 is the exact number, which kind of sounds like a policy number.
It
Mr. Campbell.
does.
Exactly.
I think we
So-
just did policy.
We just
stuff.
did.
I
So-
feel like. we
But you
did.
know me, I always want to bring you back to policy, the
Right.
things that we all love.
Thank you.
There are a series of questions I'll go through just as Mr. Rhodes did. And also just let you know that we'll share this information with you because the summary data that we have is in pie chart form. It's really easy to understand, very visually, I think helpful. It's going to be in our return to learn information that Dr. King mentioned on Thursday. But that first and most critical question was, if we are allowed to return in a face-to-face environment, what is your comfort level, with your child returning to school? And the answers were, of course, comfortable with minimal or no concerns, somewhat comfortable, or not comfortable at all. And the comfortable with minimal or no was 36.9%. Somewhat, but concerns, 37.2. So almost dead even.
Wow.
And then the remaining not comfortable at all, 25.9. I'll emphasize what Mr. Caldwell just shared because I don't think it can be said enough. For everyone that finds himself in that part of the pie, there is a fully virtual option that will be made available to them. Because as you said, Mrs. Holt, again, we want every parent to be able to choose. We may not be able to control the decision that's made by the governor. Should it be safe for us to return, that folks will have that opportunity. And so again, you'll see 37.2, 36.9, and then 25.9. The second question on the survey, you may remember, was how comfortable is your child? Not just you, but how comfortable is your child? Comfortable with minimal or no, 43.3%. Somewhat, but with concerns, 34.2. And then not comfortable at all, 22.5. So when you think about that, you've got over 55% of your student population that may have some concern with returning to a face-to-face environment like that. We asked the question, of course, about transportation. It was pretty consistent with what people are currently doing. I won't share that data set unless you have that curiosity. There was a question about internet access. It's something this board has talked a great deal about how would you describe your internet access? And remember that first choice was reliable, unlimited internet access. 76.7% said they had reliable, unlimited internet access. Reliable and limited was 13.9. And then the smaller pieces of the puzzle, again, just fractions of that, are unreliable and then no internet access. Okay. The final one was how often will a child have an adult available to help them with remote learning? Remember, the most positive choice was almost always, and then frequently, infrequently, and almost never. 42.1 said almost always.
Wow.
Awesome.
30.2 said frequently.
Wow.
What was
said-
that number?
30.2. So 72.3% said always or frequently. Infrequently is 19.8, 20% of our population. And then almost never is 7.8. 8% of our population indicating that almost never would they have an adult to be able to support them. So we're very fortunate that we had the respondent levels, and I think we can assume, as Mr. Craven, I believe, said, that several parents were speaking for more than one child. They were speaking for children in multiple school environments or otherwise. When you think about having, 13,500 students roughly and 7,400 respondents, that really is from a psychometrician standpoint, that's a very healthy response rate. And so we will certainly be sharing this with the public, but also using it to inform our decisions to help us moving forward.
When I picked 3 of my kids,
Mhm.
does that count as one respondent? And then does that count as, are you counting those 3 kids as 3 separate data points for their?
So your response data, I believe, counts as one, but we have some response questions that show us that you were responding for more than one child. It says that you've got a child that, you were able to check all the schools that apply.
Okay.
And so we're able to see that. We have a breakdown by where the parents are, in terms of, it was really exciting to see some relative consistency across school environments, but we also had some outliers. We had some school communities that responded at much higher rates than other school communities. The most equitable distribution, interestingly, was across all grade levels. So from kindergarten through 12th grade, we almost had a consistent response rate for all grade levels. It wasn't just like elementary parents versus middle parents versus high. Where the greatest disparity is between individual school communities, you know, in terms of the number of parents that chose to respond.
Now, did you see the people like out in Edneyville or North area that their internet access was prohibited? 'Cause
We've
that's what
not
I
drilled the
kept hearing
data
it.
down
Okay.
that far. We can look at individual
good
response
one.
rates to really kind of disaggregate.
If we could see their school rate with that, with like she's saying, with
Yes, sir.
no reliable or no internet access, that would be really helpful.
Yes, sir.
And then
Absolutely.
did you notice that you got responses and no schools were checked or grades were checked?
I haven't been through it to that level yet.
Okay.
I've only looked this weekend at the summary data, which
Okay.
takes all the responses
Everything,
together.
okay.
We, of course, will be drilling down into it to help inform the decisions as we move forward, because Mr. Caldwell says it best, like, there's a great fluidity to this, not just the guidance, but we know in the coming months, the conditions will change, you know, not just, we talk a lot about August right now, but there's also September and October and November. And he has challenged us to think about all of those things and really work through that.
And probably when the decision's made, some of those are going to change too, because the reality is going to hit those parents.
Yes, ma'am. This was just how'd you feel in the moment. You're exactly right.
I mean,
Did-
both ways.
Yeah.
Either way that you're
Both ways.
going, it's,
Right.
yeah.
And I think there's a lot of truth to our relative level of concern. Depends on how close it is to us, right? When we have, you know, a family member who has a concern or other, it's like anything else. I know that, you know, my personal concern regarding cancer changed when my wife went through that
Right.
journey. It was just different, you know, as a 42-year-old man, it felt different, you know, when that was that experience. So I think this is where our community was last week, and we'll see that evolve.
So
Thank you.
the only other kind of question I have, I know we've talked a little bit about there being live classes throughout the day. Will those be recorded? Because, and thinking about parents and, you know, their schedules, there may be a parent that works third shift, so they're sleeping until noon, but then they could get online with their, you know, second grader and do work. But that could have happened at 9 a.m. Like, I was just curious as if that would be recorded, so then they could go over it, you know, at 12 or 1 or, you know, whatever. Just trying to be flexible for parents, because I know it's going to be different for everyone.
With many thanks to Mr. Fender and his staff and all of their research, we will have the recording option for classes.
Okay.
And we'll be able to check attendance, I guess, on those.
Yes, it
Because
will
we're gonna-
track, it will track login and attendance.
Because virtual's got to look different. There has to be a little bit more accountability.
Absolutely. And our teacher survey that we did early on, right at the end of the closure period, the building closure period, one of the teachers' frustration was, and part of it honestly was when some decisions came from the state about how grading would work, that did play into some students' level of engagement. But we know from the requirements in the state remote learning plan that you're reviewing the draft of now, that attendance is a daily requirement. So when we hear that, you know, 80% or so of our families have reliable internet, we know how to take attendance if you have internet. What we'll be working on is how do we take attendance for our families who do not have reliable internet, that sort of thing, if remote is the option. But to your point, Mr. Craven, it will not only has to look different, it will look different, because we'll be covering new content, taking attendance. Grades will not look like grades looked this past spring.
Yeah, things in my house have definitely changed. My wife has started back to work, going into the office, and was just told that I'm not going back to the office till after the first of the year.
So you're praying for school.
And so I don't know how I'm going to do it.
17.
You know, I talk to clients all day. I was on the phone literally from 7 o'clock this morning until I walked into this door. And I don't know how I'm going to help my kids. All of them get online, much less my kindergartner. My 8th grader, I'm not really worried about it. Second grader, she's pretty cool. But Xavier John, it's going to be a challenge for, you know, I have resources to help my kids, and I've got enough computers for all of them to have if they need to be on there at the same time. I'm not sure how many of our parents are going to have that. We'll definitely have to look at that even more. This is going to be crazy.
Well, I like.
It's
how-
already crazy.
I saw how Summer with Education Foundation put out that
Yes,
community survey.
that was
and
nice.
I had the opportunity of being one of the groups to fill that out. And it was really nice because I think as a community as a whole, we'll be able to take care of these other small issues of people that don't have access.
Yeah.
This even in the survey said having access to your facility or your Wi-Fi. So where people can still access online.
I think it's just going to be a big change when more parents do start going back to work. The unemployment rate goes down. If restaurants open up and then we are virtual, I think a lot of those respondents are going to change because, like you said, that was last week's answers. And last week we had 2 parents in my house helping. And I'll be honest, my wife did 99% of all the school stuff with my 2 kids last year. And then when it's on dad, I'm.
You got
Ooh.
PE, sir.
Yes. Absolutely. I'll tell you right now, I make
PE
them
and
go
lunch is on-
outside all the time. They
Yeah.
are running.
Yeah. PE and lunch was under Mr.
Yes, absolutely. So it's scary for all of us.
Well,
I want to ask Scott a question. Scott, how has the athletics with the social distance and everything, how's that gone?
To the mic.
I just read in the Raleigh News and Observers, because I was there yesterday, that they've canceled everything.
Oh,
No practice, no athletics, no
I didn't know
nothing.
that.
You know, before he talks, well, no, go ahead.
No, spoke to Dwayne Durham with Pardee, UNC Healthcare, who helps and runs our sports medicine staff. And he's been traveling out as well to see all of our student athletes. And so far, it's gone very well. Our coaches have done an extremely great job of preaching the social distancing, so much so that my own son, who is a junior at East Henderson High School, plays football, came home to complain that he had to run. I said, Nathan, that's the purpose. You're supposed to be running. He goes, I know, Dad, but we weren't staying 6 foot apart and we had to run. So our coaches really understand the severity of what we're trying to accomplish here. And they also realize that, you know, how important it is that our student athletes through phase 1 do everything possible to keep each other safe. Because we also realize there's no phase 2 without having a successful phase 1. And so I think right now the North Carolina High School Athletic Association is again waiting on the governor. And once that comes out, I hope that we will get some guidance from them as well concerning athletics and moving forward.
Let me ask a question. There's no schedules that have been made yet, right?
Well, yeah, our fall schedules have already been created. They're out and they're
What-
ready.
What's the first football game?
I don't know that off the top of my head.
Call it August, whatever.
It's usually the week, the first one is usually the week before school starts, so it
Yeah.
should be that
Well,
Friday.
22nd.
so, but we started a little bit earlier this week,
Right,
this
so
year.
it should be that first
So
week.
21st.
my thing is this: no matter which of the A, B's, or C's that you look at, I don't think it bodes well for any type of contact sport. I don't know how you stay 6 feet apart and you play football.
Or basketball.
Or basketball, that's more in the winter, and wrestling. I mean, is that possible? Shadow wrestling. And so I don't want to give our kids a false sense of hope. Like, you're going to be playing football in a month. You're going to be, I mean, they haven't put pads on yet.
17th.
So
No, that's not right.
I just hope we aren't giving those kids a false sense of hope.
Yeah, and I'm going to speak just more as a parent real quick than I am as an employee.
Yeah.
I'm really thankful right now that Nathan has an opportunity to be around his friends
Yeah.
and to get out and to exercise in a safe environment. I'm thankful for that opportunity. He and I have had very honest conversations. Obviously, he knows what I do for a living. And we don't want to create false hope, but I do believe we want to create hope. Because I'll be honest with you, I think that's what's keeping all of us right here going, is we do have hope for a better tomorrow. And I hope that our High School Athletic Association is being very creative. I hope that there will be an opportunity for, if we don't have football in the fall, that maybe we have it in the spring.
Yeah, I think, yeah.
So I think for right now, for Nathan and for our other student athletes to be out in a safe way and to be able to participate has been good for them. I think it's been good for our coaches. And as long as we can continue in a safe way, hopefully that'll stay that way. And then we will wait for guidance and we will hope that it's positive.
No, I agree totally. I think one of the things that I hope the North Carolina Athletic Association is thinking about is possibly flipping those schedules. Because I know, my youngest son is playing Little League Baseball down at Jackson Park right now. I see people playing tennis. I play golf pretty regularly, just along with a lot of people in this room.
A lot of travel baseball, and a lot of travel softball, and a lot of volleyball going on other places.
And so if they could switch those spring and fall sports, and then really you start thinking about women's soccer concerns me because they might not call it contact, but it's a contact sport. And then you kind of get into the wrestling and the basketball into December. That's where it's going to get interesting. But I hopefully we will play football this year. I just don't see how it happens in 3 weeks or 4 weeks.
Another thing, how are we going to limit the stands?
Oh, shit.
Oh, yeah.
So I don't know. I think that's where I go to Dr. Jan King's card.
That's her department now.
I think I've got
She's
that
athletic
underneath my
director.
shirt. I'm gonna put that right here since I don't know and pull that out right here. I don't know, but I do know this. I know that once some decisions are made, we're going to get some guidance, and we're going to do the very best we can. I am very excited to be able to tell you that we do have our systems in place in all of our gyms and at our stadiums that will be able to stream those athletic contests live this year. That is a huge deal. So we're going to be able to, hopefully, in some scenario, at least if possibly the families can attend, we can still broadcast that for other folks.
Mm-hmm.
So we're going to search for win-wins at every opportunity that comes our way. And again, I'm very hopeful that we're going to have some positive news that continues to maybe come our way soon.
Can you send us some more information on those systems? And I think that might be good once we get everything going to kind of get that out into the public and let folks know that we're going to have these systems available so they can watch their kids
Yes, sir. I'd
from
be
a safe
happy to.
distance.
I'll go ahead and send that to you in just a second.
Thank you.
Now, Mr. Rhodes, as far as athletics goes, I know right now practice is not what practice would be looking like, correct, for any
No, sir.
sport?
There's no balls for the student athletes. There's no throwing the football or anything like that. So right now, it's mainly conditioning and also just an opportunity to learn plays. And I know Nathan specifically is ready to learn some more plays and for the quarterback to start throwing the football. He is coming home very tired from running.
That was the worst part of August practices
Hey,
was the
listen,
running. It was the
Listen, Mr.
absolute
Caldwell
worst
coached me
part.
that he knows how I feel about running.
Yes, yeah.
Chase, if I'm
They
running.
got
On the negative side, if we have a kid who gets the COVID, what do we do about practice and whatever?
So in this case, we have protocols that are in place that follow the North Carolina Department of Health and Human Services guidelines. So we would treat that as the same as if it were any other person who comes in contact. So if they are to be tested positive, then they would be quarantined and they would be out so many days. So we do have processes in place if that were to occur.
But do you let all the parents of the other players know?
So yes and no. So what happens is that those student athletes right now are in pods. So for example, a total of 25 people can be in an athletic field at one time outside and 10 inside. That counts students and adults. And so if we were to have a student athlete who were to be tested positive that was in one of those pods of athletes, and then they would report to the health department that they had tested positive, and then they will go ahead and do the contact tracing through them. And then those student athletes, depending on if they were, within 6 feet for more than 15 minutes at a time, then they would be told to self-quarantine. Possibly, maybe not. But that would be a determination that would be made by our health department, not by us.
So, yeah, child, the health department wouldn't make those calls. And then the health department, it's the school system. We're not the ones who's going to quarantine. Anyway, it's going to be, once again, that's a health issue. So they'll take care of that part of it. So, child feels sick. And of course, once again, the biggest education for anything, and you've seen it. If you feel sick, don't come. If you feel sick, don't come to practice. If you feel sick, don't come to work. I just took my daughter to Atlanta, and so Saturday I'm driving to Atlanta, and I'm reading these, the big signs over the interstate, which is the when you get a warning or traffic jam or anything else. Well, somebody from Atlanta DOTs, I guess they're just having fun because, drive like your mother's watching. Wash your hands like your mother's watching. If you're sick, your mother says stay home. I mean, it's just a constant reminder. But I appreciate them doing it because we've got to continue to educate our families, especially right before we get ready. Depending on what happens on August 17th, the great education for families is really try to concentrate and stay home for those 2 weeks right before school starts, if possible. To make sure that every child is as healthy as they can be when they come to school. But that will be taken care of by the health department. We are not doing middle school right now. It's just high school, correct?
Yes, sir.
We're going to look at that come August 1st. We're also going to look at all extracurricular. Come August 1st, it's just not the band, Mr. Craven, ready for Friday night, or it's just not the football team ready for Friday night. It's the band.
Sure,
They
yeah.
start with their camps on August 1st. So a decision will have to be made on that. As well, when we start looking at if this continues, they'll follow in the same protocol of taking temperatures and no larger than this amount of groups that can be on the field at the same time.
Take the temperature of these kids that come to practice daily?
Yes, ma'am. So each day the student athlete shows up, and again, I want to say that it's optional. They have the opportunity to come, but it's required of none. But it's open to all. But when they come on campus, their temperatures are checked, and then they go through the 4-question screening process to see if there have been any symptoms before they're able to participate. And they also stay with the same group. There are no cross-contamination, so that if you're with that group of 25, you miss Monday at 8 o'clock, you can't go to the 9 o'clock group.
So tell me, we are not asking if you've been out of the country, are we? When I go to doctor's office and they ask me that, I'm like, did you not hear we got COVID right here in Henderson County? Like, why are you asking me if I've been out of the country?
Yeah, Ms. Holder, we're it's really amazing. I had a sidebar with Mr. Campbell because there's been a great discussion about those 4 questions, and we're going to ask a kindergartner who's had perfect attendance if they've been out of the country for the last 4 days. So therefore, that will be in our presentation on how we're going to handle that with both elementary, middle, and high school, and then also with staff. And just visitors who walk in. This is something, once again, we talked about last Thursday is, how do you handle the UPS person? How do you handle the milkman that's coming in the back, or your parent who's coming to check out a child for a dental appointment? These are all protocols that we've set and talked about on Thursday, taking Billy throughout the day. And then if Billy has an appointment, how does that look, or in this kind of thing? Once again, that's under the great work of Dr. Bryant Operations, Mr. Rhodes, with the staff and certainly Dr. King with the education. And then we have we've got huge committees with principals, assistant principals, all working with their leaders. And then once those leaders, and I think you were presented with the leaders of all those different committees that we have, and that's who we had in our room on Thursday, and that's who's going to present with our principals once we know what the plan is. Once again, the state and the governor lets us know what's plan that we're on, then we're ready to make some decisions. Not our decision. Once again, the governor with the state health officials will make a decision.
I've got a question on the testing site for East. So hypothetically, school starts back in some form or fashion. Will they move that testing site away from East Campus? Do you know of?
Michael, I'll certainly have that conversation with Steve. Probably, I would certainly say yes at that point, just due to the fact of congestion at that site. But we'll certainly talk to Steve Smith about that when time comes, once we know what the plan will be.
Yeah, because I just know some parents have expressed concern.
Sure.
I don't want my kid to go to school while there's testing.
Sure,
going on.
I certainly understand.
And then the other one is hypothetically if we're going back and the community college buildings are closed, will that affect IHS? If they close their
I mean,
campus?
that's something we're just going to have to work out with Dr. Leatherwood. Now, the last I heard, they were planning to continue,
person.
and they're going to open
Yep.
in person.
Well, I'm just saying.
Yeah.
Right now, they
hypothetically.
have in-person school.
Right now, they're doing summer school in person. Now, you
Yes,
got
they
to
are.
remember, when you're dealing with college level children who certainly understand, and so therefore, and they have small classes. I would assume that the community college, if we're on plan A, which is everyone, or plan B, which is a percentage, the community colleges will be open as well. So I don't think there'll be an issue. As far as, of course, plan C, we're remote. But the communication that we do with we have many strong partners with Henderson County Public Schools, but we work so well right now with the relationship with Blue Ridge Community College, and what we're getting done jointly with them is just absolutely tremendous. So I don't think that will truly be an issue, but appreciate you bringing it up.
I assume we'll be flexible with attendance this year if we're open and kids have to self-quarantine. And
Ms. Holt, that is a great question. In fact, I brought that up, and my whole staff and I brought it up laughed at me, but I'm not going to tell you why. But I went old school on them. But anyhow, yes. I mean, when we can't send a 10-day letter home when we've quarantined a child for 14 days.
right.
I mean, let's just be honest. So yes, attendance has got to be, on one hand, on plan A and plan B. Principals, once again, the 23, we'll send them some parameters, but they're going to have to look at every child's attendance. And if a parent feels like that their child is 100, because I know this is online, but I'm getting ready. A couple of times when my child had 100.4, we popped him full of Tylenol and says, you just stick it out till lunchtime and let me know how it goes. And so therefore,
That's the truth.
so
though.
therefore,
That is
that's
That doesn't happen
yeah.
at my
Everybody.
house.
Yeah,
I
so-
can't tell you.
okay,
It's
I
like
got you.
daycares. Are you kidding me?
So but now it's no, you stay home. And so therefore we're going to have to be lenient with attendance. Now, on the other hand, option C, we're going to have to really kind of
Right.
be more aggressive with attendance, because everybody was present last time when whether they
Right.
showed up or not. So yes and no. A and B most definitely look at policies, most definitely look at principals and how they're going to work with families on attendance. Option C, we're really going to almost have to crack the whip to make sure that kids are online and getting the work done, because it's just no more of every child, counted present, and you just get the grade that you had last year or something. I don't know.
So legally, and this might be a question for council, is the health department, because of HIPAA laws, allowed to say Susie B has to be out for 14 days because we've told her to quarantine, and send that information to the school so the school knows?
So what they're able to do is they are able to tell individuals and identify the individuals who needs to be quarantined from, a health perspective. To my understanding, then that is going to be part of, excused absence for the child. The parent would report that like they normally would. Now,
I'm
what I
worried about
don't
the
know,
parents that don't report it because they
Right.
can't stay home.
that's what I was going to say. What I don't know is if the information comes to the parent and doesn't come to the school district at all, can the health department share that name with us as somebody who's to be quarantined? My understanding is yes, because that's part of a quarantine order, but that's a great question, something we'll follow up on.
Okay.
And then one of my other questions too is, will we have to waive graduation requirements for next year? And will we have to waive attendance policy for next year?
Graduation such as.
So for instance, what if there's a kid that misses a whole semester or something because of COVID and misses a class, then we have to waive?
I think when it comes to making some decisions, I guess maybe even Christmas time for those who could graduate at Christmas, we'll just have to look at those on an individual basis just to see where we are before we just start basically waiving all graduation. Knock on wood, we may have and we may come out better than this because we're kind of thinking of the worst case scenarios now right now. Things may all of a sudden progress and we start doing well. I think for us is looking at it, what we'll have to do is instead of making wholesale changes is deal with everything individually with the child. The principal still have the right to reduce the number to go back to 22, looking at those type of graduation rates. If a child can't make 28 for some reason, this is another one of those life-altering things that basically we could certainly look at.
Well, that's why I was thinking if it was easier
I'm not sure that we're ready to do that yet. I would
I
like
think
to
it's
see how this whole
dangerous
thing.
to do that sometimes, because not dangerous, but we saw the attendance drop significantly when PC-19 came about, and I know our schools did a heck of a lot better job than say some other school systems around us as far as keeping our kids engaged. And I think if you make a blanket policy like right now, like you get COVID and you're out, whatever, your attendance is waived or your graduation requirements are waived, I think it could send, you gotta make sure it's the right.
well, if you got to look at the history, if he does close school or puts it on Plan C, DPI is going to release guidance again, close to almost probably the same stuff. And they love releasing the guidance without telling us ahead of time.
Well, and once again, I think that
Now, if they release it, they release it.
And we'll, I think once again, we'll deal with what happens. I think when you say you just use the two magic, what if this and what if that? And I used to work with no coach that what ifs were always just, Coach Pryor always had a little saying that kind of just left me. But, I think right now we just can't, we'll just have to deal with what we're going to deal with when it comes. I wouldn't jump into changing policies at this point. I wouldn't jump into certainly making any rash, quick decisions about this. I think this is a thoughtful plan that we have for you once we release it. We have investigated every possible solution that we can. We've looked at property, trying to figure out how we could even try to bus kids to other areas. But now all of a sudden you got to remember, I can't hardly get them to school for social distancing, much less if they're one per seat trying to take them to other locations. We have thought, I think you challenged us, Mr. Craven, if I remember a couple of minutes, to think outside the box. Right. And we're trying to think outside the box the best we can, but yet we're also in the box of trying to provide our children a safe and healthy environment. And all of a sudden trying to take children off campus when we lose all of the safety protocols that we put into place without an administrator. Plus you got to remember, if only 50% of the kids can be there, you're trying to relocate 7,000 kids somewhere. And so
3,500 have already said they're staying home.
yeah.
That's
Well,
only
it may be.
There's a light.
There's a light. And yeah. So
You can't just forget about the physical safety that we've put into place just because it sounds good. You could take them all to this facility or that facility. The same with taking temperatures, of every kid. You go have a big line outside the door. That's totally unsafe. So there's all these kinds of things that we just have to. We're going to be making changes, or you guys are going to be making changes. Not board policy, but as you're going to do that every day, something's going to happen.
our goal on August the 17th, if we are Plan A or Plan B, which is either all in or basically half of us in, is we will have control. Now, will it work 100%? That's our goal. I believe that's kind of what I told my staff is my expectation, is I want it to work. But will there be glitches? You're right, Ms. Coyne, there are going to be glitches. We've never taken the temperature of 1,000 middle school kids walking in the building if we're in Plan A. Now, granted, we can get as many thermometers and we can get as many staff because this is going to be a duty. This will be a teacher duty, is taking temperatures. There's no way about it. I think you asked how many nurses, 17 nurses, 23 schools. One nurse could not even take the temperature of 1,000 kids. So we're going to have stations. We got protocols. What happens if the kid gets temperature? Where do they go? What happens if we retake it and they get it again? So these are all protocols of all these schools. And we've got the plan. But I'm going to tell you, there's not a picture perfect plan anywhere, because if it is, there are 115 school system districts that would, we would buy one if we saw the perfect plan. I would tell you, Mr. Craven, I'd say, make an amendment to the budget and let me,
Do it.
let's go buy this
Sign
thing.
it right
But
now.
there's not a perfect plan. So you're exactly right, Ms. Corn. The changes will be made. But once again, it's the safety of the staff and the children that are most important.
Do you have any general operations? Or
I
you
do not,
good?
sir. I will quit my sermon, sir.
All right, so before we end this meeting, I just want to remind everyone at home or watching and all of our board members, once we do get the whatever is handed down from the governor, I want to give these guys a couple of days to kind of put everything together. Then we're probably going to have an emergency meeting to talk about that. That could be tomorrow, that the governor comes back,
I've
Wednesday.
heard
Wednesday.
It's going to be the 17th. It's going to be
What's
Friday.
that?
He makes
Friday?
the announcement.
So if that's Friday, we'll give them a couple of days. I'll talk to Bo, Mr. Caldwell, see what type of time he needs to be able to present
Do
to
something
us.
maybe
and
Tuesday or
then,
something like that.
be prepared. We'll probably 24 hours notice. I'll give you guys to let you know that we're going to have a meeting. Does that work?
Thank
All
you.
right. Any questions, comments, concerns?
Yes, sir. It's my honor and pleasure to serve, sir.
Good deal. I'll take a motion to adjourn.
So move.
Second.
All those in favor say aye.
All right.
Hi.
We are adjourned.
Yes, sir.
Tell me when we're off. All right.